VA health reform. This discussion begins with a question. What is the best way to provide for the medical needs of our veterans? Beyond question, we have an obligation to provide for their care. Beyond question, the current state of affairs is unacceptable. The poor quality of care provided our veterans is a national scandal. In Phoenix alone, more than 200 veterans have died waiting for medical care. I don't want to turn this topic into a political football or make a blanket indictment of Veteran Health Administration employees, many of whom are dedicated and diligent health professionals. The problem and the solution lie within the system and the culture that system fosters. The system demonstrates all the attributes of a single-payer system. The best description of this model is Soviet. It is not an exaggeration. The VA operates under the same business model that produced depressing public housing made of concrete and the Wartburg. The Wartburg was an East German car that was underpowered by a smoky 3-cylinder 1-liter engine. It was notorious for having brakes that would overheat and fail. They even had an ambulance version. How'd you like to go to the hospital in this, Jan? I believe the Berlin Wall fell because of the Wartburg. That and the fact that nobody wanted to wear Bulgarian shoes. Our veterans deserve better. Consider this. What does the government do well? No, really. What does the government do well? Surprisingly, the answer is not nothing. Government does do some things well, but providing service is not one of them. It seems odd, but a good example of what is good can be found in the VA. Think of the GI Bill. Millions of homes were built because of veterans' housing benefits. Millions of veterans went to college because of veterans' educational benefits. It must be pointed out that the VA and the federal government provided the funding, not the actual service. They didn't build the houses or operate the universities. They only provided the funding. If they did provide the services, it would be a total train wreck, just like their hospitals. So where do we go from here? Ironically, the model is another government entity. Even more ironic is that that entity is in Illinois, the bastion of waste, fraud, corruption, and mismanagement. The Illinois Department of Transportation, IDOT, along with some other public entities, is responsible for investing billions of dollars into and maintaining roadways, railways, airports, and mass transportation systems. This transportation network is an economic engine for the state of Illinois. It's IDOT's mission to facilitate safe, cost-effective transportation. Now, IDOT doesn't actually build anything. They couldn't build a birdhouse. The projects are contracted out to civil engineering firms, design firms, road contractors, and construction management companies. Companies like HNTB, Parsons Brinkerhoff, IHC, Walsh, K5, Plody. These companies have been in operation for generations. They know what they're doing. IDOT puts projects out to bid, and construction-related companies do the work. The Veterans Administration should emulate the IDOT model because they have made it abundantly clear that they are incapable of operating a healthcare system. Worse yet, they're arrogant about it. They have joined the long list of public servants who have become public masters. Fortunately, an alternative already exists and could deliver the exceptional care our veterans deserve almost immediately. Clearly, the VA doesn't know what they're doing. You know who does? Northwestern Medicine, the University of Illinois Health, University of Chicago Medicine, Advocate Healthcare, Mayo Clinic, Cleveland Clinic, and other hospitals across the country. Healthcare is what they do, so let them care for the veterans. The current VA health budget is $65 billion. If that money was applied to traditional health insurance coverage, it could provide for exceptional care with zero out-of-pocket for veterans. That's right, zero copay, zero co-insurance, zero deductible. The time has come for American taxpayers to stop funding an expensive but poor quality service. The time has come to take definite steps to fulfill the promises made to the men and women who have risked all and suffered all to secure freedom. Let's keep the VA in charge of activities they do well: education, housing, job training. Let's get the VA out of the healthcare business. Lastly, there is a legitimate concern for the employment of those people currently working at VA hospitals. Since the net demand for healthcare would not change, the net employment need not change either. Those employees would find new positions in real hospitals. Come on, people, we can do this. Those are my thoughts. You can leave your comments below.